Here with my daughter Paulina to share an exciting new project. Over the years, we've talked to a ton of young people about what they really want to know about relationships.
It's difficult to know who you are and what you want, especially as a teenager. And not everyone has access to an expert in their house like I did. Of course, it wasn't like I was always that receptive to that advice.
Right, no kidding.
But now we have written the book on consent. It is called It Doesn't Have to Be Awkward, and it explores relationships, romantic relationships, and sex.
It's a great guide for teens, parents, and educators to go beyond the talk and have honest and meaningful conversations. It Doesn't Have to Be Awkward will be on sale September 21st.
You can order your book anywhere books are sold. Amazon, Barnes & Noble, Target, and of course your independent local bookstore. Links are available on drdrew.com.
So pre-ordering the book will help people, well, raise awareness, obviously, and it'll get that conversation going early so more people can notice this and spread the word of positivity about healthy relationships. So if you can, we would love your support by pre-ordering now.
Totally. And as we said before, this is a book that both teenagers and their parents should read.
Read the book, have the conversation. It Doesn't Have to Be Awkward, on sale September 21st.
Hello, everyone. It's a dose of Dr. Drew.
I don't think that was on mic, Susan. Let me try that again. I
Me?
couldn't hear you. Yeah, I couldn't
You
quite
can
hear
hear
you.
me? Oh, you told me to turn down your earbuds.
Ah, maybe that's the reason. There we go. I
Is that
apologize.
better?
Let's try that
Hello,
again.
everyone. It's a dose of Dr. Drew,
I hear
too.
you loud and clear. Thank you so much. Today, we're going to do something a little different. We're going to talk to one of my peers, Dr. Peterson Pierre, who is a dermatologist, board certified, a Stanford dermatologist to be specific. He has a extensive knowledge in all things skin and all kinds of things that people are thinking about their skin these days, particularly as they get older and particularly as UV intensity goes up. Dermatologists are being kept very busy. He has the Pierre Skin Care Institute in Thousand Oaks, California. And Dr. Pierre, welcome to the program.
Thank you so much, Dr. Drew. It's a pleasure being here.
I saw you met your wife at medical school. Is she a physician also?
She is. She's a pediatrician.
Fantastic. And you guys are where now? Where do you practice mostly?
I'm in Thousand Oaks still. My wife gave up her career about 18 years ago to raise our kids.
Oh, my God.
So my daughter is now in college. She's a senior, and my son is a sophomore in college as well.
Hats off to your wife, first of all. Like, that's a major sacrifice that many dads don't make. I'm not pointing my finger at you. I'm just saying general, number one. And number two, the great news is she can go back. You know what I mean? This is the great thing about medical training. She will have utility, especially these days.
Exactly.
Yeah, so awesome. All right. Dr. Pierre has an Instagram site, Susan. I don't quite see the Instagram. Why don't you give us the Instagram and whatever other website you like people to know, Dr. Pierre?
Yeah, it's at Pierre Skin Care on Instagram, Facebook, Pierre Skin Care, our website, pierreskincare.com. So we're pretty easy to find.
How did you get involved? How did you get an interest in dermatology? Was it, some people back in my days, the best and the brightest tended to go into dermatology and ophthalmology because they were interesting fields, but also because people had more of a containable life. It wasn't, working in the ICU overnight. So it wasn't so much always interest in skin. It was sometimes interested in the practice of these disciplines.
Lifestyle,
yeah,
right.
Yeah. Was that you or no?
No, that was not me, actually. I went into medical school wanting to be a surgeon. And, that sort of started back when I was a child. Quick story, I was watching All My Children with my mom because she loved that show. And I remember there was a scene where there had been a car accident and the parents were really concerned. They were talking to the surgeon beforehand, please save my son. So next scene, surgeon comes out, everything's going to be okay. Family's super relieved, so grateful. And right then I knew that's what I wanted to do. I had never even heard about dermatology until I was in medical school. So they did a 1-week lecture series on dermatology, and I thought, wow, this is amazing.
And you get to do a little
There's
surgery.
so much variety,
I've noticed
easily accessible.
A lot of people that are interested in surgery like dermatology because you still get to do a little surgery.
Exactly.
Yeah.
Exactly.
Good
and
for
it's
you.
so visually oriented, and that's sort of the way I'm wired anyway. It was very interesting. So I did my first rotation in there. And one of the things that I noticed, as opposed to other rotations, everyone there was happy. They were happy with what they were doing. They were happy being at work.
That's right.
Which was not the case with my surgery rotations.
Right, right.
So,
especially the medical students and residents. Yeah, that's so true.
Yeah,
so true.
So it sort of embodied everything I was looking for, not just in my career, but also in my life.
You know what got me?
I wanted to be there for my family.
I got to tell you, I liked a lot. I decided I had to do everything general. That sort of, I realized one day, like my last rotation, my third year medical school, I was like, I really came here to just do the general stuff. I liked everything. I wanted to do everything, but I'm like, nah, that's why I'm here. But I loved dermatology and I loved neurology because every syndrome, it's not really because of this, but every syndrome was very definable and usually distilled down to 3 letters. Lichen simplex chronicus, LSC, and Charcot-Marie tooth, right? CMT. And in neurology, it was all named after French neurologists from the turn of the 20th century. And it wasn't so much names in dermatology. There was a fair share of names there, but it was always like 2 or 3 letters. And I sort of loved that. I sort of loved that things were very discrete and specific, and you could really define them well.
Exactly.
Yeah, I remember LSC, and then the other one was the other one that when I realized I was falling in love with dermatology, it was some one of these inflammatory serpiginous rashes, and it also had like 3 letters. I'm like, oh, this is great.
What?
So there's
we have a lot of those.
Yeah, right. I know. What's the bad one? It means a cancer is in there. It's got a raised border. Can you think of what that is? What am I thinking of?
Oh yeah. So sometimes, I mean.
Uh-oh. Damn. And I'm feeding back too at the same time. Dr. Pierre, you may have to. There you are. Are you back? You kind of froze for a second there. Tell me the name of that. Tell me the name of that illness again.
Said the C word.
Yeah. What was the name of that illness again?
Oh, I was saying a lot of times, a lot of these skin conditions are related to internal malignancies.
Oh, yes.
And they will be one of the first signs. And there are several of them, but we have a lot of acronyms in dermatology. So
love it.
That always makes for interesting conversation.
Love it. I just thought that was so, I don't know, for some reason it really caught my attention. And again, very, very definable conditions, unlike, psychiatry. The opposite thing would be psychiatry, where things are sort of artificially kind of put together, and I like that too, but I got very involved in that. But derm has its own way of seeing things, and a good dermatologist are really good physicians, right? Because you're thinking about all these differentials that you're seeing. You're not sort of just seeing a itchy rash and thinking eczema, right?
Right, exactly.
You're thinking about lichen planus, and you're thinking about what might be going inside and why this should be happening.
That's right.
Yeah, and most people don't appreciate that about dermatology. By the way, that's the other thing, that's a relationship between dermatology and psychiatry. Very often, the psychiatric syndrome is caused by or exacerbated by an underlying medical thing, and that was a lot of the stuff.
That's correct.
I ended up doing. But let's talk a little bit about what's new in derm, what's good in derm. Oh no, there is one other issue I want to talk about, and this actually, I don't know what to do with it exactly. So you're going to help me with this. Dermatology was dominated by professionals with light skin.
And there are very specific needs of all sorts of skin types based on ethnicity and genetic backgrounds. And I would dare say, like most thing in medicine, we've been remiss in not paying more attention. So tell me about what's new there and how that can be done better.
Well, I think that's something that we've been talking about now for the past 5 to 10 years. What do we do to increase that diversity? Because if you look at the population of the United States, there's quite a bit of diversity there. Yet when you look at medicine in general and dermatology in particular, dermatology is the second least diverse specialty after orthopedic surgery.
Interesting.
So that's definitely something that needs to be addressed. So what we're doing, we're working with a variety of medical societies and organizations to really put together a comprehensive plan. Obviously, this is not something that's going to happen overnight. It's going to take time. So what we're doing, we're working with medical schools right now, trying to decide how to properly screen applicants. What are the sorts of criteria that you should be looking at beyond what the GPA can tell you, beyond what the MCAT scores can tell you.
Right.
We're also looking at what can we do at the college level. Like for me, I'm a perfect example. I didn't know about dermatology until I got into medical school. what can we do to drive people in college into the medical field? And then even going beyond that, we've got to reach back to the high school level, even to the middle school level, introducing these kids to the whole idea of STEM and science and things like that, getting them interested in that. And then hopefully, obviously, this is going to be a project that takes a number of years, but we should be able to see the fruit of our labors later on. But this is something that's extremely important.
Yeah, I agree.
Because patients feel more comfortable seeing people who look like that.
It sort of goes without saying. You know what I mean? It's like we should be embarrassed and let's get on with it. We should be embarrassed about what we've been, how we've been, and let's solve it. But I want to also talk about the special needs of scarring and pigmentation and the things that, unless you have skin of, and by the way, again, it's a spectrum, right? When do people start to have those sorts of issues? And talk to us about that.
Yeah, so that's something we're also working on right now. There should be, right now there are several atlases available. Unfortunately, a lot of dermatology programs do not have specific training in skin of color, depending on where they are geographically and things of that nature. So a number of programs right now are looking at building a skin of color clinic. And I know that's something that Stanford University in particular is working on, along with other programs. There is also a comprehensive atlas that should be coming out soon that really covers a lot of different conditions in skin of color, because they can look different.
Give people some examples. We have lots of listeners with varying skin tones all over the place, and give people, when do they worry, what should they worry about, and what's available to them?
Well, I would say, typically for someone who's, let's say, Asian, Mexican, or darker, you're looking at, if you got a rash, that's definitely something that should be addressed, other than trying to deal with the itching, the redness, and stuff like that, because that can lead to the pigmentation. And everybody hates pigmentation.
Yeah, and the pigmentation is not just from the rash; it's from you scratching and irritating it, right?
Correct.
So
any kind of inflammation in that area
don't
will
scratch.
damage the pigment
Don't
cells.
scratch. That's number one. And number two, if you scratch and break the skin, scarring can be a thing that's different. And by the way,
absolutely,
I've noticed also scarring's different as I've aged, which is another topic. So please have at it.
That's definitely true.
Yeah.
So unfortunately, as we age, a lot of those beneficial hormones that we had when we were younger, that sped up healing and things like that, sort of decrease. Collagen production decreases, elastin production decreases. Scarring is a lot easier to have and a lot more difficult to get rid of naturally, which is why you need to turn to different sorts of procedures.
Such as?
But if you have darker skin,
let's stay with the white people first.
Who you see for that?
So the white people are old, like Susan and me. What kinds of procedures are available to us?
I beg your pardon.
What kind of stuff's available to us? And then we'll talk about dark skin. What's available to them?
Yeah, depending on the degree of scarring. I mean, you could do something as simple as a cream. You can do chemical peels. You can do microneedling. You can do laser treatments. There's a whole variety.
And microneedling, PRP, you're talking about.
Correct.
Yeah, got it.
You can do it with or without PRP.
Oh,
because
interesting.
Because the whole idea is you want to stimulate that healing.
Oh, interesting. And so personally, I use retinoids as a way of sort of, I don't know, I have all this actinic stuff on my forearms, and it's just reducing it. It's certainly reducing the actinic nodules and the tendency for basal cells and that kind of stuff.
I have a new camera, and you can see how pink his skin is.
Oh, that's retinoids on my face. That's different. What I'm talking about. We'll talk about that in a minute.
I mean, look, he uses that so much. Look how pink his skin is. But he has great skin, but it's just always
that should be part of everybody's regimen, honestly.
It's always raw,
That's one of my questions. Does that matter? Because there's a certain amount of inflammation with retinoids, does that matter on your skin tone?
It does. So the key thing is you want to start slow. Mm-hmm. So if you have sensitive skin that's easily irritated, you start slow. I usually tell patients 3 nights a week, Monday, Wednesday, Friday, moisturizer on top. And then we gradually titrate up so you can get the full benefit. But there's no reason why in 2021, we can't find a retinoid to work for even the most sensitive skin types.
Yeah. So let's just start. We haven't talked about needs of dark skin and scarring yet, and also keloids. We got to talk about that. But before we do, are you suggesting that most people, particularly people in these high UV territories, or particularly people that spent time in the sun when they were younger, should be using retinoids?
100%.
Susan, listen to that. Because I get lots of shit from people.
I use them.
Because I
just don't use them every day like you do.
Susan,
I mean, I use them.
Dr. Pierre, you didn't know you were going to get into a interpersonal conflict as well. But Dr. Pierre, what do you say?
Yeah. So I think there are a few things with that. And Susan, your particular situation is very common among my patients. So there are a lot of different retinoids. So perhaps the one that you're using is a little bit too strong. So that's one factor. Other factor is maybe you need a break-in period where you're using it just a few days a week in the beginning to slowly build up.
Well, that's what it says on the package.
Moisturizer on top.
Yeah.
I do.
Moisturizer is key. It's really underutilized in this situation because it can make it more tolerable and allow your skin to adapt faster.
And
I can tolerate it. Now what I do is I take hyaluronic acid and then I mix it with that and I put it on instead of straight on the skin, and it does a slight peel everywhere.
You really got to use it regularly though. You really do. You're you're regular about it. And you
but I go in the sun. I don't use it in the summer because
Dr. Pierre, help me.
So sun protection. Sun protection is not a seasonal thing.
I use that too.
That also is a 365-day-a-year thing, regardless of the climate you're in.
Yeah. It's true, but I also do lasers, and I do like IPLs.
But lasers are catching you up for what the retinoids might have prevented.
My skin reacts really well to it, and then I also do PRP, and then I use the retinoids in between, and then I also use good skincare, stuff like hyaluronic acid and vitamin C, and I use a lot of stuff.
It seems to me that
but that's what we need to talk about is my over expenditure on creams.
Right.
Yes.
And
that's a very combination.
Well, go ahead. And then underutilization of a retinoid, which is the thing that's actually going to work. But go ahead, Dr. Pierre.
I use it. You're just defending yourself.
No, I really think you don't. I honestly, I mean, with things like, is it Diperline? That's the weak one. What's it called? Diperline? What am I thinking of?
Different.
Different.
Adapalene.
Adapalene, right? Adapalene. You can use that like crazy, and it's so mild, and it's like, just go use that one, and it won't bother you so much.
What's adapalene? You never gave
Go ahead, Dr. Pierre.
Adapalene is a retinoid as well.
I bought a new one. I went to the dermatologist yesterday, and I picked up a retinoid cream that also has something else in it. I can't remember, but I'm going to start using that at night.
Okay.
I mean, I just picked it up because he has like the super strong Retin-A that I mix, but I just thought I'd try something.
Yeah, take something weak. Don't use my stuff. I use it because I started using it because of adult acne. I have cystic adult acne, and it works like crazy, and so I just kept using it. I thought, well, this is going to have real benefit too. And now I put it on my ears and my forearm and everywhere else where I'm starting to have real actinic changes.
Dr. Pierre, I have a question too.
It has a lot of benefit.
Yeah.
Does the retinoid work well on your neck and your chest? Because that's my worst.
It does.
Yeah.
But just keep in mind the skin in those areas is a little bit more delicate, so you have to be real gentle there.
Okay.
I already have poikiloderma on my neck.
That sounds gross.
And does that?
Yeah, that does happen.
What can be done for that?
Well, at that point, poikiloderma is basically a combination of red and brown. So you've got the vascular component with the redness, and then you've got the brown discoloration. So if we're going topical, obviously sun protection is key. Then you want to fade the brown with hydroquinone and things like that.
Oh, interesting.
And then for the red, you're looking at laser treatments. We have really good laser treatments, IPL, that can work on that and really reduce it.
But there's
rosacea.
There's a cobblestone-y kind of quality to it. Is anything be done for that?
Yeah, the best thing you can do there is laser treatments and then some retinoids to improve it.
That's what I figured.
Unfortunately, we can't reverse it back to the way it was before, but we can get it better.
The problem with the retinoids is that is an irritated area, and of course the collar makes everything worse. So, all right, Doctor, who's here?
Dr. I don't know my kind. Dr. Yo is here. He has a question.
Oh, Dr. Yo, let's see.
Can you fix diabetic skin conditions due to drinking alcoholism once you stop and reduce your sugars? Can one heal with lifestyle changes, or is the skin just stuck? Okay,
so hold on. Dr. Yo, diabetic skin conditions and alcoholism. So are we talking about porphyria cutanea tarda? Are we talking about chronic spider angiomata? I mean, what are you talking about? And that's the liver disease side. On the diabetic side, plus all the infections and scarring that alcoholics get. Dr. Pierre, I'll let you talk about the diabetic skin conditions.
Yeah, if we're talking about stasis dermatitis, I mean, there are so many different changes that occur in that.
Yeah.
So it really depends. So if we catch it early, we can definitely affect it. If it's been going on for a number of years, there's not a whole lot really that can be done, unfortunately, just like anything else in medicine. The sooner you catch it, the better off you are.
Yeah, Dr. Yo,
but I think it's just an individual basis.
There's so many different diabetic skin conditions. I'm not quite sure what you're going for. And as Dr. Pierre says, the lower extremities, that's a whole thing, which is dealing with stasis dermatitis. I mean,
it's tough.
Oh my God, that goes from
circulation, and there are a number of factors at play there.
Yeah, and with diabetics, it's both ways, arterial and venous. And
exactly,
and it goes from a mild, sort of eczematous kind of an eruption to just catastrophes you can't imagine that Dr. Pierre and I have seen. I mean, you can't even imagine. You're an anesthesiologist. You've not seen this. Trust me. It can look like it can look bad. It can be very bad, and you're just doing the best you can. And the wound healing becomes the biggest issue, frankly.
It becomes a big issue.
Yeah. Joshua just suggested we turn on the Clubhouse if you want to take some questions.
Not yet. We got Dr. Pierre and I have.
I know.
Lots
I can tell you guys need to nerd out for a while.
Yeah,
okay.
yeah. Because we haven't even begun what I was actually interested in, and we haven't let him talk about the stuff he's come here to talk about. So let's get to dark skin and scarring and keloid. Let's talk about that.
Yeah, dark skin and scarring, definitely an issue. I mean, for even, as you were mentioning earlier, acne. That's one of the most common things I see. Patients who come in, they have acne, but what distresses them even more is the discoloration. So I typically will treat those simultaneously. Let's get the acne under control, because the longer the acne stays, the more scars you're going to have. But let's also start dealing with that discoloration. So my treatment of choice, combination of retinoid and hydroquinone, works beautifully. If I have to do antibiotics, that's fine too. So we get that under control. If we're looking at sun, so a lot of times, depending on how dark your skin is, you may decide, well, sun protection is really not for me. Fallacy. I have patients use sunblock regardless of their skin tone, because pigmentation will always be susceptible to sun.
Oh, interesting.
Keloids, definitely more severe. It's basically an overproduction of your skin is a little overzealous in the healing process. So now they can be super disfiguring. What I use there, we'll start with some cortisone injections to really calm down the inflammation, decrease the size of the scar. There are other things we'll inject sometimes, like bleomycin or 5-fluorouracil, to really get that to calm down. I have patients who are literally awake in the middle of the night with pain from their keloids, and they get a lot of relief from these treatments. So it's a lot more than just cosmetic.
And then keloid? You sort of, people struggle with keloid formation, whether dark or light skin. What's the sort of spectrum of?
So usually you'll know whether or not you develop keloids. Sometimes patients will call something a keloid that's really not, it's just a scar. But a keloid, you'll know, is an overgrowth of scar tissue. So you'll have these big nodules, even though you had just a little cut, or even from acne, you'll end up with this huge scar. And so in situations like that, you really want to minimize damage to your skin. So preventative, there's not anything you can do about the skin itself to prevent that from happening, other than really being careful about procedures or injuries and things like that. Second, as soon as you do have an injury, it's probably best to get that addressed right away. Dermatologists are specialists in dealing with that, so we can really minimize the formation of those keloids after your injury takes place. Now, if you already have keloids, there are definitely things we can do to get you some relief.
Excellent. Let's do kind of wander on. Oh, somebody had a question on my stream here. They said that they work for a medical spa and they're seeing overuse of retinoids. So how do you know when you're doing something too strong?
That sounds like you.
Here we go.
Yeah, I mean, if your skin is constantly red and peeling 7 days a week for weeks at a time, yeah, you're probably overdoing it. Now, part of the problem, though, is not just the retinoid. Sometimes people are using other things in addition to. If a little is good, more is better, right? So they're putting it on like a moisturizer.
And they're putting benzoyl peroxide on top of that.
Yeah, they'll use benzoyl peroxide. They'll use glycolic acid. They'll do home chemical peels. Your skin can only tolerate so much at any given time.
And so, so what Susan is getting on me about, I have this back and forth where I have something wrong with my pore function, whereby if anything covers it, I get cysts. and I have to wear makeup. I have to wear makeup all the time on TV, and so I'm always fighting the makeup with the retinoids and stuff.
But look how good his skin looks.
skin-
Still looks amazing.
It looks great.
I mean, he
skin
doesn't
is
have any
held up.
So
wrinkles.
obviously what you're doing is working.
Listen, Susan, you hear what he said?
No, I think it works. I tell people all the time that people are like, God, his skin looks so good. I'm like, he uses Retin-A, you know. But sometimes
I didn't start it for wrinkles or anything. I started for adult
it's a little
acne.
dry around your eyes, and the makeup people go crazy because you don't want to put any cream on or anything.
Yeah. It strains around my eyes. You can do.
He doesn't put any cream on at all, his face or his skin.
Because
ever.
anything that covers my pores, I start to get trouble.
I know.
Anything.
I know.
And so.
Even around your eyes?
Creams or Retin-A's?
It burns it.
No, creams.
I
around the
don't. I
eyes.
don't. I could though, because it doesn't bother me there. You're right. I'm lazy.
But he always goes,
so I would
"Oh,
do that
Yeah.
at least.
It stings," and he cries.
Yeah, it does sting a little bit, but whatever. It's all good. So let's wander
It's all
into.
about Drew here.
Let's
okay?
wander into. No. I thought that we as case, because you and I have a lot of derm stuff, and so we as cases are kind of interesting to sort of examine this.
I mean, I wish I had more Retin-A when I was younger, when I was a kid, because I had horrible acne.
Oh, you did not.
Yeah.
I did around my mouth and stuff. I still have scars and stuff, but I mean, it went away as I got older. Yours has gone on forever. He went on Accutane once, and he turned into a maniac.
Yeah, Accutane.
He had
I was
horrible
on it for
skin
about,
problems.
I was. It did put me in a position where the Retin-A started working.
Because they weren't working before the.
I mean, he would have typically, like, in our 30s and 40s, he'd have a big zit in the middle of his forehead that they'd have to cover and stuff. Like, he always had a big pimple.
And those are hard to cover.
Yeah, and so the Accutane, I was on so-called low dose, and after about, I think it must have been about 3 months, and I got sort of addicted to it. I'm like, oh my God, you can put makeup on, you can do anything. My skin is great. I was like, holy crap, there's never been like this before. And but I started when I started pushing on the accelerator of my car instead of the brake, I announced that I either need to see a neurologist or get off this medication.
So he went crazy.
No,
but
it was not good.
also like imagine as a teenager having to wear the mask and having this horrible acne too. I mean, it covers it up temporarily, but I can imagine like with the bacteria and the masks now and these kids, you must see a lot of people who have that problem.
I see a lot of that, unfortunately. Yeah. I mean, we treat it regardless. Obviously, you have the friction and the humidity and the sweat and the bacteria from the mask, but we can still treat the acne and get really good results.
Yeah, there's such new technology that's so good.
That's the point. Let's wander right into beauty and aging and that stuff. What are you most excited about? Let's ask that in terms of new interventions for dermatology that on the beauty and aging front.
I think one of the most exciting things is really addressing the loss of volume. So that's something that really had not been talked about for a long time. Obviously, we know if there's sagging skin, surgery is the best for that, to redrape. But once we start in our 30s, the production of hyaluronic acid, collagen, elastin is decreasing, and we start hollowing out. And really, the best solution to that, to make you look as natural as possible while still looking your best, is just replacing what's been lost. So we have all these great fillers, hyaluronic acid, they're natural products, we inject them in there. Key thing is you need a really good injector who's not going to make you look overdone. You want to look natural, and you can get some really, really nice results taking 2, even 5 years off for a simple in-office procedure with no downtime. Laser procedures are also amazing. That can also take several years off, depending on what type of laser we're talking about. I mean, there are a lot of things we can do nowadays that we simply could not do 10, 20 years ago.
And which lasers are you sort of interested in? Because there's a lot of stuff out there.
Yeah, we have a number of different lasers. I would say the two that I use most often are the carbon dioxide laser, which really is phenomenal for brown spots, wrinkles, scars, discoloration, texture, tone, and everything. You do have the downtime with it. So
what does that mean?
Part of the challenge in Southern California, where the weather is great all the time, people don't necessarily want to deal with that downtime. I moved to my other laser, which is the 1927, milder form of the carbon dioxide, requires more treatments, but your downtime's only 2 days.
What do you mean downtime? What does downtime?
On board with that.
What does downtime mean? Does that mean you're actually peeling or inflamed?
Downtime means downtime 2 days you're red.
Red.
You peel a little bit. Downtime with the carbon dioxide, you're swollen actually for 2 to 3 days. You're really red like a terrible sunburn, and then that gradually fades. But by the time you heal, you've got that baby smooth skin.
Yeah, so Drew, you know that little scar under my eye? And then Dr. Stout actually burned it off a little bit. My dermatologist said they could, take it off. It's like I have a weird little birthmark or scar under my eye. And, but I have to have like a week to recover.
Right.
Have you ever had a CO2 laser, Susan?
Yeah, he used it around under my eyes when I had my eyes lifted. And then because I have this weird little brown spot, kind of weird thing under my eye.
Interesting.
But I may do it. I don't know. I just keep putting it off.
All right. Let me see. I have so many questions here.
But I've heard about it. Sounds good.
Okay.
Also, can it take like little melias off and like does it take like any like crusty?
Yeah, that's not the best choice for milia. I mean, really, milia, if you can extract them, that's going to be the easiest way to go.
So he's meaning just kind of scoop them out.
Yeah, so you just kind of, it's like popping a zit basically.
Yeah, but don't do it.
I don't necessarily recommend you do that at home.
No, I don't. I have those under my eye too, next to that weird little, because I guess the creams clog up your pores or something.
What about systemic treatments for dermatological conditions? What's the sort of state of the art there?
Well, we've definitely made a lot of progress in psoriasis treatment. It used to be we only had either pills or light therapy or creams. Now we have all these injectables. There's probably 20 of them available right now that address different parts of the inflammatory cascade of the immune system, and you get phenomenal results. And the side effect profile is pretty good. So now we're getting people who used to be covered head to toe, just absolutely miserable. Other treatments didn't work so well. Now you've got options where you're injecting yourself even once every 3 months and getting clear skin. And the beauty of that too, it is also addresses the arthritis that can accompany psoriasis.
Right. But these are the interventions for medical conditions. I imagine, I always have trouble sort of understanding what we're all talking about when we talk about wellness versus health. And so this is really about, from my opinion, it's health, because these are inflammatory diseases. They're dangerous, frankly. But
I agree.
When it comes to wellness, is there I know PRP and stem cells, but that's all local, right? There's no systemic interventions that way. Like, does NAD do anything?
There's no systemic intervention yet.
Okay.
That's definitely something that's been looked at, other than hormone replacement.
Right.
That's a completely separate thing. There is benefit to hormone replacement because, of course, we know part of the aging process has to do with a lot of those beneficial hormones that we had in our teens and 20s being pretty absent as we get older. So the skin starts to change, body composition changes, bone density changes. So all those things, there are definitely a lot of hormone replacement clinics, anti-aging clinics that will deal with sort of that systemic type of thing, in addition to the external things that we can do.
Now, Susan, any other questions? I'm going to go into these celebrity products a little bit.
Tom Smock wants to know why the female host often injects her own personal life issues. You asked me.
The female host?
I know.
You now the female host?
Yeah, I don't know. I mean, I have a lot of experience in this. I'm a frequent flyer at the dermatologist in the laser office, so that's why I'm talking. But yeah, I don't need to talk. It's okay.
I would like her to talk. It helps. Listen, when you talk about medical issues, talking in an abstract, that's interesting to Dr. Pierre and I, but people who don't understand the landscape, we understand the landscape because we've seen these things in real life. You have to see a case. And Susan is a good case. I'm a good case.
I'm old, first of all, so I need help. But
no, we have dermatological case histories.
And Dr. Pierre does a lot of stuff. He does the.
What are you scrolling through there?
This is his Instagram. If you guys want to go check it out, he's got a lot of cool posts on here. It's a good one.
Interesting.
Pierre Skin Care. Yeah, but he does, what is it called? He does the fat freezing thing where you I had
Oh,
that.
the Cool Sculpting.
Cool Sculpt. I had that, and it worked a little bit. It helped, but
Yeah, that's
and
one of those phenomenal things that's, it's not a weight loss treatment, but it's definitely an alternative to liposuction without the downtime.
it just
Hey,
takes
who doesn't want that?
takes a few lumps out of there, and then he has cellulite treatments, and I mean he's got all this stuff in here. It's kind of cool. I mean, a lot of people are addicted to this, so I don't do as much as I would like to, but I do some of it. I mean, so we worked with Dr.
Cara, and she showed me the cool sculpting thing where it's like heat and cold, right, on your back or on your skin. It kind of like warms up the fat and burns it off, and you put this big machine on top. And then there's also the one where
So the way
okay, go ahead.
Yeah, I was going to say the way it works is fairly simple. What you do is the device will freeze the fat cells. Once you're below a certain temperature, those fat cells die. And basically they leak out the fat, your body flushes that out. So those fat cells are gone forever. Now, having said that, your body does still have the ability to make new fat cells. So patients always ask me, well, are the results permanent? The answer is yes. But if you go and add 30, 50 pounds, your body does have the ability to generate new fat cells.
Sure. Yeah, it's true. But it's like, it's just the technology is there. It's kind of cool.
It is.
So let's talk about celebrities, and they want to go at these same common issues, and there's it would seem like we've been in a wave of celebrity dermatological beauty products in the last maybe year even. I don't know if that's a COVID thing or whatever. So do you mind if I kind of scroll through 6 different celebrities and their products, or do you know these? I don't know them.
Oh, I don't mind.
Okay, yeah. So J-Lo's out there with a bunch of stuff. $150 million North American sales. Does she have? Yeah, I know. 6 products: cleanser, moisturizer, face mask, eye cream, and serum. To me, the serums seem like BS. Am I right there? And they're expensive. They're expensive BS.
I mean, if we're talking about serum, all that pretty much means is a lightweight moisturizer. The key question is, what is in this serum?
Right.
Now, you can have serums that work really well because they've got great ingredients at the proper dosage, or you can have a serum that really doesn't have much of anything or has the right ingredients, but not enough of a dose to give you a result.
And so we don't know.
Let's face it.
The average person.
J-Lo is attractive. She is older, but still looks amazing.
Mm-hmm.
So the subliminal message for a lot of these celebrity brands is that if you use these products, you too can look like her. That's the subliminal message.
Mm-hmm.
I mean, if you sit back and think about it, it's not going to transform you into J-Lo, but if it's good enough for her, it's good enough for me. So I'll do it.
And again, different skin tones have differing challenges.
Definitely.
And then Rihanna has $100 million. Jesus,
yeah.
Anything about
it's
her
amazing.
4 brands: a cleanser, sunscreen, pore refining toner, whatever that means, and moisturizer. Now let's talk about the moisturizers.
Whatever that means.
Yeah, let's talk about the moisturizers first. They're all kind of the same, aren't they? Unless you get into the CeraVe and that kind of stuff. Isn't that sort of better?
Yeah, so if we're talking moisturizers, and here's the challenge with the moisturizer. Everybody's skin is different. There's no really one size fits all. If my skin is dry, I'm going to want something a little bit heavier.
Mm-hmm.
If my skin is oily, I can't use that product. I need something a little bit lighter. But there are ingredients will work. Hyaluronic acid is one of them.
Mm-hmm.
You can use that on dry skin. You can use that on oily skin. You can use that on sensitive skin.
I
We
love
know
it.
that's an ingredient that works.
It works.
Is there enough of it in there? We don't know because they don't typically put the amount. But
Right.
the one easy thing you can do, if it's listed in the first 3 to 5 ingredients, then there probably is a significant amount in there. Then you're looking at other things like ceramides and squalene and shea butter and things like that. Depending on what's going on with your skin, that's how you pick the product. For me, it's all about, we have these great tools, but you have to pick the right tool for the job. It's not one tool does everything.
For the average person, is trial and error a sufficient way to go about it, or is there a resource somewhere?
Well, I would say there are resources. So as far as moisturizers go, there are probably 5 to 7 key ingredients to look for. Everything else is a filler. Again, I want to be clear on this. If you're looking for a result other than just moisture. So if we're talking anti-aging, you're not just interested in putting a moisturizer on, you want to see a change. Most patients who use products, I'll ask them flat out, well, do you think your skin looks better? And most patients will tell me, I don't know. To me, I don't know is a no. Because if your skin did look better, you would know that. It would be obvious to you. The other thing people do is they hop around a lot. And you really, when you're doing a skincare regimen, you've got to think about it like a workout routine. You've got to give it 3 months before you can see a significant improvement. If you see it before then, that's even better. But if you don't see a change at 3 months, more time's not going to make it better.
So I have a question. What's your favorite product? Sure. What's your favorite product for, for reversing age? Like, what would you like say? Oh, I love this stuff.
I would say, well, really, I like 3 things. If I could only have 3 things for anti-aging, these would be my products. Number 1, there's a product called Isden Airfotona Ageless. Here's the key thing about this. It's got DNA repair enzymes, which will repair damaged DNA. They've actually done studies to show that it's good for precancers, even early basal cells. That's great. It's got antioxidants and your zinc SPF 50.
How do you spell
all
that?
All rolled into one.
ISDN.
Zinc is key because it gives you the best protection against the sun.
It's ISDN ageless.
Yeah, it's ISDIN. That's the brand, and it's called Ageless.
Okay. I think I have
that. And no matter what your skin color is, this zinc product blends in beautifully.
I use it.
Perfect. 2, retinoids, which we've already talked about. And then 3, one of my favorite products is TNS Advanced Plus. So this is a product that has growth factors and peptides that help to stimulate collagen and elastin. And their data shows, and this is the only product to my knowledge to date that does this, it can help a little bit with sagging. Now, we're not talking surgery-like results at all. We're not even talking about non-invasive results at all. But will you see a difference in your skin? Yes. Typically, at about a month, you notice a change.
It's expensive.
If I could only have 3 products, those would be the 3.
It's expensive and not covered by insurance.
It is expensive.
$265.
It is expensive.
Is it once a day, twice a day?
I think it's about $295 or something like that.
Yeah.
I saw that yesterday at the dermatologist. I didn't buy it.
Is it is it once a day, twice a day?
Twice a day.
Twice a
and
day.
That can be used face, neck, and décolleté.
And you put a moisturizer on top, right?
Yes, because it's not a moisturizer. It's a treatment cream. So you can put your moisturizer on top of it.
I'm thinking from my...
So I like my retinoid at night. I like my Ageless in the morning. And then my TNS morning and night. That's the simplest thing you can do.
I'm thinking my neck might benefit from this.
Yeah.
Yeah. And the thing is, a lot of women have 10 to 15 products they're using, which I think is overkill.
Yes.
If you pare down to those 3, you'll probably actually save some money.
Drew, does this bottle look familiar to you? ISDN?
Yeah.
It's the sunscreen that I have in the other bottle. But we also use it. Drew uses that.
Yeah, it's interesting.
Yeah, but the whole idea is that you supplement this with your, $265.
Especially if you have actinic damage, that's the way to go.
I mean, I think that other product goes a long way too. It doesn't, if you use it right, you can use it for 3 or 4 months before you use it up, right?
Yeah, so the key thing with applying these products, after you wash your face, pat dry so it's a little bit damp, and the product glides on a lot more easily, and it can spread more easily.
They have a less
and it'll last you longer.
They have a less expensive thing that's recovery complex.
Yes.
Is that the same thing? Or
that used to be their flagship product until this one came out.
Got it.
So the Advanced Plus has everything the recovery complex has and more.
Well, Susan, are we going to do that?
Yeah, I use this. I can't remember I use ISDN and I use the other one. I use these Cosmetic and all this stuff. So I probably even have some stuff you can try, Drew, just to get started. And yeah.
Yep.
How about that? So
It burns his skin. When he puts it on, he's like, oh, it burns. But should he just let it burn and then just put a little moisturizer on until he gets used to it, or because
which one burns?
Everything.
Everything I give him.
Everything.
Oh. Yeah, I would say part of that is probably from the retinoid.
Yeah.
But your skin will get used to it.
But does this stuff, can you put this closer to your eyes, or should you keep it away?
Absolutely.
Yeah, he needs
You can put it anywhere.
I will, Susan, I will use that around my eyes.
Okay.
I'm sorry.
I have to make sure I'm not sure if I.
Because I bet that will deal with what you're seeing.
I know I didn't know that. I have the cream.
I have such oily skin that I need the lightest whiff of moisturizing.
Yeah.
Yeah, well, so this is perfect because it's super light.
It's expensive. You don't want to use too much at a time.
No, I'm looking at
True. But you spent a lot of money on your rent. Well, I guess your insurance covers it.
Yeah. Okay, back to the celebrities. Pharrell's got something that, as we get into these weirder and weirder names, it gets more and more.
Oh.
He's got.
I didn't know Pharrell had a line.
Yeah,
that's interesting.
Ready? It's rice powder cleanser, lotus enzyme exfoliator, and humidifying cream. So he's got. Who knows what that means? But do you know anything about those things?
I have no idea.
Is it called Bro to Face?
I'm just reading his stuff. Emily Ratajkowski has a skincare line. I'm saying
Bro to Face. That's pretty funny.
We should not even go through any of this because Dr. Pierre has told us exactly what we should do and not be swept into this stuff. Although I'm now looking at Alicia Keys. Let's see if she has anything particular for skin tone, because I just don't think we educate people enough about that, and it's been white dermatologists forever. You know what I mean? And
absolutely.
Yeah.
And not only that, we're also in the social media age right now where the number of followers will trump expertise. But if you sit back and ask yourself, okay, what do these celebrities actually know about skincare?
Right.
I don't know what they know, but they certainly don't know as much as a dermatologist.
No, not even close.
But we dermatologists don't have the cachet of some of these individuals.
Right.
So there's really no competition if we're talking about popularity and celebrity status.
I'm going to quickly show the name of his cosmetic line. It's kind of cool.
Sure.
Human Race.
Oh, nice. I like
that. I know, look at that. I like Pharrell.
I like that.
Yeah, and
it's catchy.
Well, he's going off branding.
Clean packaging.
He's just really going off branding.
Of course.
Yeah.
Of course.
And frankly,
I'll take the TNS and I'll take Dr. Pierre's recommendation. so
I know I use it. I like those products. They're really good.
Isn't that interesting? It's just so interesting how we get so the branding and the sort of feeling of applying things to your skin is more important than what you're applying to your skin.
There's
right?
no question.
Oh my God.
That's where we are right now.
That's
I can't
crazy.
tell you the number of people who come in and tell me all the things they've tried for their acne. It's not any better.
Oh, that's true for sure.
And within 2-3 months of seeing me, their skin is clear.
Of course.
They didn't have lasers when we were kids. I would have lived to have a laser when I was a kid. Like, I had the worst acne. It was terrible. And,
I'm sorry.
But I also was a cosmetologist. I went in, I had horrible acne, and I went to an esthetician. She wanted me to go to cosmetology school to become an esthetician. And, I mean, that's how I got into all this stuff. So I didn't get a medical degree, but I could have used a dermatologist in those days, but I never went. Or they'd give me stuff. Maybe I went once or twice, and they'd give me stuff, and it would just burn so much, and I was like, no, I don't like this. So, anyways, enough about me. I know it makes my audience mad, but here you go.
No, they're not mad.
No, this is good because you're a real life patient.
Somebody asked
a lot of people out there who are listening feel exactly the same way you do.
Exactly.
B-World wants to know what the quick trick for acne is, and we'll close with that because Drew has a spicer hit in a few minutes. But
ooh, quick trick. Okay, so let's define quick. If you've got a major event coming up on the weekend and you go see the dermatologist today and you've got a few terrible pimples, cortisone injection. That's a quick trick. A day or two, they're gone. If we're talking about quick trick within a month, definitely retinoids got to be part of that program. If we've got more time, then we've got better things that we can do and get you better results. But if a patient comes in, sometimes I'll get, like yesterday, I had a patient coming in, I'm getting married in a year. Wonderful. You will look amazing by the time we're done. But I have also gotten, I'm getting married next week. give your dermatologist enough time to transform your skin.
Sounds good.
I want to talk for just a quick second, just to indulge myself on skin conditions that I love as an internist, just because they're so fascinating to me, and one that not enough of us were trained on. For instance, the syndrome of lesser Trelat. You ever heard of that one?
Yep.
It's a sudden, and people should be aware of this, sudden onset. Maybe sure I get this wrong from a dermatological perspective, but from an internist perspective, it'd be sudden proliferation of seborrheic keratosis.
Yeah.
Which are these sort of black.
Yeah, it is fascinating. Yeah. I mean, we don't really even know what causes seborrheic keratosis to begin with. But then to have this syndrome where, hundreds and thousands pop up all of a sudden, and we still don't really know why. And since we don't know why, we don't really have a solution yet.
Another one.
It is fascinating.
It's a fascinating and challenging is acanthosis nigricans.
Yep. That too. There may be some hormonal mediation there.
What?
It's funny it's definitely more common in overweight patients.
Listen to this. I saw it in a transgender patient taking a bunch of estrogen. And I always wondered if that was the issue. And she also had hidradenitis suppurativa in addition to AK, or AM, whatever you call it. And it was always, I was like, oh my God, it's got to be the hormones doing this. It was so pronounced. Morphia.
Yeah, there's definitely a link there.
Morphia, however you guys say it.
Yeah, that's tough. So if it's localized, it can be treated fairly simply, and sometimes with just topicals, corticosteroids, vitamin D. If it's systemic, that's for sure a lot more challenging.
How do you spell that,
And it
Drew?
can be debilitating.
How do I spell which?
That thing you're talking about.
I just mentioned 4 different things. Which one?
I don't know. The ugliest one on a picture.
The morphia?
Hidradenitis suppurativa is the nasty.
Hydradenitis.
I better write it down if you want to write it down.
Hydra. Is it one word?
Adenitis.
It is one word.
Nitis.
Hidra.
Suppurativa. I think that's it. I think that's it. I think I
might have found it.
I just spelled it.
Hydradenitis. There it is.
Yeah, it's nasty. And then some of my favorite henoxone-like purpura and cryoglobulinemia.
Here, I'm going to show that.
The skin manifestation.
Is that it?
Yeah,
that's it. Yeah, that's it. But and of course,
it's not pleasant. And
I know.
Speaking of skin of color, there's definitely a predominance of skin of color when it comes to hidradenitis.
That's right. This woman was a darker skinned person. That's right. And HSP, henoxone-like purpura. I would love that one.
Yeah, that one, definitely see that in kids, usually related to some sort of infection. If you can recognize it early enough and treat the infection, then you can really curtail a lot of those manifestations. So it's important, obviously, for pediatricians. It's not so common in adults, but it's important to at least have some working knowledge of it so you can spot it sooner rather than later. And then you've got the kidney issues and so on.
Yeah. Go. It's
thrombotic thrombocytopenic purpura, essentially, right? Isn't it? Associated with that. And then finally,
what is the one? The post-venular inflammatory condition that kind of looks like, I think it's maybe it's henoxone-like. It kind of looks like a petechiae on the lower extremities, but it's actually an inflammatory. It's a vasculitis. Post-venular. I can't remember the name of it. Anyways, this is the stuff I love about dermatology because it's so encyclopedic. You know what I mean? It's an encyclopedic.
Does that
that's
look
how
like
my
it?
brain
Is
works.
that what it looks like? Because I put those words in.
Which
this
is that?
What popped up?
What words?
Post-venular vasculitis.
Yeah.
Vasculitis.
What does the name say? What is the name?
Cutaneous small vessel vasculitis.
Yeah, because they're
Curious.
Usually dermatologists have somebody's name attached to it.
Vasculitis. Yeah.
Not HSP, any of those things?
This is just vasculitis.
Okay, we'll keep
pretty nice stuff you're bringing up here,
this
Drew.
This is all stuff I cut my teeth on.
I mean, my stupid little birthmark under my eye doesn't look so bad anymore.
No, listen. You've not seen. You don't know what the skin can do. I mean, listen. If you've ever seen Stevens-Johnson syndrome,
look at that poor baby right there with its legs all.
And bullous disease too. I was treating a pemphigoid for a long time. It was very difficult before we had.
Terrible.
And then pemphigus is like, whoa. It's sort of. Isn't pemphigus normally
I'm randomly
fatal
putting
or
these words
associated
in.
with fatal conditions?
Oh my God.
Pemphigus?
It can be.
Yeah.
That's a pemphigoid.
Yeah, pemphigoid's nasty.
Yeah. I mean, these are things that a lot of people don't associate with dermatologists because obviously they're rare.
Well,
So, but
funny.
you can really change someone's life around
How
if
do
you
you
can get
get
their
that?
condition under control.
How do you get that?
You get unlucky, or it's maybe an underlying condition of some type. There's something called the Nikolsky sign that differentiates pemphigus from pemphigoid. And the thing about pemphigoid is it gets into your mouth and your eyes, and it's just terrible, terrible, terrible.
That's a Nikolsky.
Yeah, very painful, debilitating.
Yeah. Oh God, this is just giving me the EBGBs. You guys think it's funny? It's not.
I told you I love derm. I love derm.
Okay, I'm going back to the restream.
Yeah, so if that's the case, don't ever pick up a derm textbook because there are
No,
going to be things you see in there that you wish you never saw.
He used to get these journals, and they'd have pictures of these horrible diseases on them when we were younger, and I quit looking. You had a skin disease magazine.
I remember now the name of it's leukocytoclastic vasculitis. It's that category of leukocytoclastic.
LCV.
Yeah. LCV. but this is all stuff, this is all stuff that on medicine we have to know about, because if you even have a hint of that, we sometimes don't even have time to get the dermatologist involved. You know what I mean? We got to get to the systemic part of this. And the dermatologists are more helping us confirm the diagnosis and take the biopsies and that kind of stuff. So
exactly.
All right, let me go back to our restream here and see if people have questions. Let's see. Derm rocks. People are saying thank you, Casey.
Oh, of course.
Hang on a second.
I'm glad you guys like it. I'm feeling nauseous from looking at it.
Oh my God, you're so funny, Susan. This is more fun than I thought we were going to have.
I know. I've got
fantastic.
my skin is crawling.
Legs are still scarred. Casey, from what? I'm sorry, I can't see what you guys are talking about. They're all getting into our medical jargon in the picture.
Right.
I like this.
Casey said they were peeling skin off of his feet in the hour. He was in the Afghanistan war.
I see. Stefan, that's a really interesting idea, is to bring Dr. Pierre over to I do another podcast where they just like looking at disgusting videos, essentially. and I've never thought of doing it from the dermatological perspective, but it might be interesting to do. It's a very interesting thing. Maybe we should do just a quick second, because I really do have to go in 5 minutes, but on wounds. How do you know when wounds need more care than just a Band-Aid?
Well, you definitely want to find out if there are any underlying conditions. So I have a number of patients who have quite a bit of edema in their lower extremities. In that particular situation, wound healing is going to be challenging because your circulation's not good. You already have all this extra fluid in that area. So now we're looking at compression. We're looking at leg elevation in addition to the wound care. If there's no underlying circulation issues, venous issues, diabetes, and things like that, then taking care of the wound itself is fairly straightforward. You definitely want to keep it moist, whether you're using something as innocuous as Vaseline or Aquaphor, or if you want to use a topical antibiotic or anything like that. Keep it moist because the skin cells heal from the sides and they like a nice moist environment. That's sort of counterintuitive, because a lot of people feel like, well, if I let the air get to it, it'll dry, which is true. It'll scab. It will eventually heal. But now the skin has to work its way underneath the scab, which takes longer than if you keep the area moist.
Interesting.
But depending on the size of the wound, it can take a while. I mean, wounds on the legs, if you're young, obviously it'll be faster. Pretty much any kind of healing, if you're young, will be faster. And any kind of healing, if you're older, will take longer.
I'm just looking at a couple other things, medicine-wise, see if I can. Yeah, this is all. I still haven't found the name of that thing I was thinking of that I asked you about at the very beginning. Maybe you guys don't have recharacterized it. I can't find it. Anyway, okay. Let me look at the restream real quick before I let Dr. Pierre go, and I've got to run myself. Let's see, genetic eczema, direct sun diminishes. Any other recommendations? Okay, here's somebody with a husband and daughter have genetic eczema, so-called. I don't know what that is. Direct sun helps diminish, which makes me think it might actually be more in the psoriasis zone. Other recommendations?
Well, I would definitely say, in addition to that, moisturizer helps a lot. And then you really need to see a dermatologist.
Yeah, I think
you probably need some topical steroids and things like that to really calm down the inflammation.
Or maybe
there's only so much you can do on your own.
I hear a story like that, and I think she needs a skin biopsy too to really firm up the diagnosis.
Yeah,
right?
could be.
Yeah,
depending on what's going on. Absolutely.
Yeah. Well, Dr. Pierre, it's been a pleasure. It's been a pleasure. I hope we stay in touch. As I said, I might bring you over this other podcast. And if we're
I look at gross skin stuff.
And where is your clinic?
It's in Thousand Oaks,
so
California.
You might see.
So that's like halfway between Los Angeles and Santa Barbara.
You might see Susan Pinsky knocking on your door sometime soon.
Okay.
If I were making predictions, I'm going to say that see reasonable probability that might happen for the CO2 laser.
Happening.
I knew that was what the thing was, and then she'll drag me along. But anyway, pleasure to meet you. We don't normally indulge in all this in this particular stream, but we thought it'd be fun to do it, and you exceeded my expectations. So thanks for playing along. And those of you who didn't like Susan ringing in, you don't have to stay here. You don't have to be part of the stream. I thought she did a really good job of because you definitely need a woman in this mix too.
Well,
to talk
and I
about
produce
this
the
stuff.
show, so without me, there's no show. Just get used to it.
That's the other piece. That's just generally so. But I mean, this particular topic, I thought it was.
And
really,
I'm his
really
wife, so I have seniority.
Yeah. Oh yeah. And frankly, this whole streaming show was her idea. During the darkest days of COVID, she was worked with Caleb Nation and thought we should do this. And so I was like, all right.
Wow.
Yeah, isn't that funny?
Great idea.
Yeah, and so we've been doing it ever since, and it's turned into a really interesting little product. So
it's a fun hobby for me.
Let's let Dr. Pierre go. We'll talk about upcoming guests. Okay, Dr. Pierre, thank you so much.
God bless you.
Thank you so much. I appreciate the opportunity. It's been a lot of fun.
Instagram and website.
PierreSkincare.com.
At Pierre Skincare, website, PierreSkincare.com.
Fair enough. We'll see you soon.
Very straightforward and easy to remember.
Thank you, Dr. Pierre.
Bye.
Have a great day.
For the rest of us, we have Trisha Paytas coming in next Thursday. Is that correct, Susan?
Yes, we do. And I don't have the banner yet because Caleb had a rough night with the baby.
Oh,
but that's
Caleb is extremely excited about Trisha coming in.
Next Thursday on Ask Dr. Drew.
And will that be at a different time?
We're moving Ask Dr. Drew to Thursday because we're going to meet Caitlyn Jenner at the party on Wednesday.
Right.
So hopefully we'll be able to get her as a guest as well soon.
Okay, great.
She's very excited to meet you.
Great.
And then also we have a couple of really good guests coming up. We're going to talk about hormones with Dr. Donovitz.
Good.
On Tuesday,
Good.
we're going to talk about cancer and testosterone and all the findings that he had. He was previously a guest on this show. And also on This Life #YouLive.
Right.
He's got he does the bioidentical hormonal treatments, and he's very knowledgeable. So tell all your lady friends, men too, I guess, can have testosterone replacement as well.
Yeah. Yeah, that's true. And we're going to go over some of the science on that. Dr. Donovan's very knowledgeable in this thing.
And I'm glad you guys like the dermatologist. He's a nice guy, and we really appreciate his PR person for setting him
Angry
up.
Bear, Trisha Paytas is in here because I went over to H3H3 and tried the Frenemy show. I tried to help them with that relationship. And Trisha was always kind of mysterious to me. She was on the Adam and Drew show once. I didn't quite get her. But on Frenemy, she was very forthcoming about her psychopathology and her treatment. And I thought that was very courageous and very interesting. And so since then, I've been not just a fan, but somebody I look for opportunities to talk with her and to bring her into these kinds of contexts. What is that? What's that
This
picture?
is Trisha Paytas.
Is her
if anybody wants to know
Twitter.
who she is.
Okay, she's entertaining, she's interesting, and she's honest, and I like that. And so we'll bring her on.
She wants to talk. She'll probably want to talk about her new mental health podcast.
Oh, how about that? See, I saw her going in that direction. Good for her.
I don't know. I just saw a little clip.
That's
she said,
interesting.
I'm just starting a new podcast
good for
called
her.
My Chemical Imbalance.
Good for her, because she good for her. I fully applaud her. I'm becoming a Trisha fan.
She's got 1 million followers, so she might be fun. A nice switch up here.
So here's the deal.
I like dermatology though.
Yeah, I gotta run here.
It's all about me.
But who is on Tuesday?
Tuesday's Dr. Donovitz.
And Thursday, and we're just doing 2
Wednesday,
shows?
we'll just probably do something on the fly after, before we go over and meet Caitlin. I haven't set anything up because we had to move our Ask Dr. Drew to Thursday.
Okay, got it.
And
we could do Friday next week.
Yeah, we could do Friday because we'll be home all next weekend.
Yeah.
You can do, or we can do the weekend if people prefer.
There's the Corolla barbecue next week, everybody.
We have the Corolla barbecue.
Maybe do a little local broadcast from there. That's what I'll try to do. Okay, everybody, thank you so much. We'll see you on Tuesday.
Okay. Nice extra ready. I'm not ready.
Oh, well.
Okay. Get some Hydrolite.
Okay. Anyone who's watched me over the years knows that I'm obsessed with Hydrolite. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydrolite contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydrolite has got your back. Hydrolite Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single-serving easy-pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydrolite Plus Immunity comes in convenient, easy-to-pour sticks that rapidly dissolve in water, make a great-tasting drink, has 75% less sugar than your typical sports drink, uses all-natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydrolite Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy, or as always, you can find it by visiting hydrolite.com/Dr. Drew. Again, that is HYDRALYTE.com/DRDREW. Be sure to use the code. I want to give a shout out to our good friends at Blue Mics. If you've heard my voice on this show any time over the past year, including right now, you've been listening to Blue microphones. And let me tell you, after more than 30 years in broadcasting, I don't think I have ever sounded better. But you don't need to be a pro or have a fancy studio to benefit from a quality mic. You may not realize it, but if you've been working from home or using Zoom to chat with friends, you probably spend a lot of time in front of a microphone. So why not sound your best? Whether you're doing video conferencing, podcasting, recording music, or hosting a talk show, Blue has you covered. From the USB series that plugs right into your computer to XLR professional mics like the Mouse or the Blueberry we use in the studio right now. Bottom line, there's a Blue microphone to fit your budget and need. I can't say enough about Blue mics, and once you try one, you will never go back, trust me. To take your audio to the next level, go to drdrew.com/blue. That is drdrew.com/BLUE.